Boris Johnson has admitted a coronavirus second wave is coming to the UK. The Prime Minister warned that the UK is now seeing a second wave coming in, and that it was inevitable that coronavirus would hit the country again. Mr. Johnson said a second lockdown was the last thing anybody wants, but said the current measures would need to be kept under review. Speaking in Oxfordshire, the Prime Minister said, "On Monday we brought in the measures that we did, the rule of 6, to really try and restrict what people are doing, and to bring in a new buffer and to make it absolutely clear, the rule of 6. Indoors 6 maximum, 6 outdoors maximum." But the crucial thing is at the same time to observe the basic rules on social distancing, hands, face, space. That is what everybody has got to do if we want to continue to beat this thing. But as we look at this particular curve and what is happening now, clearly we are going to keep everything under review. I don't want to get into a second national lockdown at all. It is the last thing anybody wants. I don't want to go into bigger lockdown measures at all. We want to keep schools open, and it is fantastic the schools have gone back in the way they have. We want to keep the economy open as far as we possibly can. We want to keep businesses going. The only way we can do that is obviously if people follow the guidance. It came as it was reported that ministers were considering nationwide coronavirus curbs, which could see hospitality businesses forced to shut, are being examined to prevent a fresh wave of deaths. Asked whether ministers were considering a short firebreak lockdown, Mr. Johnson said, "We're watching it the whole time, and as soon as we've got more to say, we'll be saying it." Close quote. He added that any rule changes would be fully explained to the public, adding, "If and when we have to go forward with other local or national measures, or whatever, we will of course be explaining very clearly to everybody how we see it." Close quote. Mr. Johnson reiterated that people should keep up with wearing a face covering and washing their hands, while only those with COVID-like symptoms should go for a test. The PM rejected suggestions that the government had eased lockdown too quickly and instead suggested discipline in adhering to social distancing restrictions had slipped. He said, "If you look at what's happened over the last few months, I think the British people have done an amazing job. They got that peak under control. They brought it right down. They brought the number of infections right down by discipline and everybody adjusting our behaviours and the way we go about our lives, hands, face, space. And I think probably, truth to tell, what's happened here, and what alas has happened in so many other countries is that people find it difficult to keep this up. It is very difficult to maintain that kind of discipline for a long time, and what you've seen is the disease starting to spread again among young people, and that's where it really started to kick off in France and Spain in those age groups, and we are now seeing that here in this country. And alas now it is progressing, and now seeing an increase in incidence in the 80+ group as well. So that's why we took the measures we did on Monday, action on the rule of 6, as the disease progresses. If that isn't going to work, then of course we are going to have to take further measures, but be in no doubt that we will want to be explaining what we are doing, taking people with us as we go, and what I don't want to do is go into a second national lockdown of the kind we had in March, April. I don't want to do that again. Active discussions are reportedly underway in Number 10 about how to respond to the sharp increase in cases. And one option on the table is a short period of stricter rules in England, which Downing Street denied would amount to a full-scale second lockdown, which Health Secretary Matt Hancock said would be a last resort. A Number 10 spokesman said, "We've always been clear that our strategy is to keep the virus down as much as possible while protecting education and the economy. We are prepared to take action that is necessary, but we obviously want to avoid any extended lockdown." Large swathes of the country will be slapped with tough new curbs from Tuesday, the government announced today. Parts of England's northwest, West Yorkshire and the Midlands will have restrictions imposed after the weekend. Elsewhere, Independent Sage claimed that the UK has reached a crisis point and needs to take urgent action to bring the virus under control. The group of independent scientists has claimed that Britain is just 1 week away from seeing levels of hospitalizations from coronavirus that were seen in March. Coronavirus outbreak. New modelling by neuroscientist Professor Carl Friston of University College London shows that the UK has only 2 to 3 weeks to improve contact tracing if we are to avoid another national lockdown. And they claim that with the epidemic doubling every 8 days, the UK's hospitals could soon be at a crunch point. Mathematician Christina Padgel of UCL warned that hospitals risk being at March 17 levels by next weekend. Professor Friston said, "Modelling shows a simple doubling of the efficacy of the test and trace system from 16% to 32% would bend the curve and save about 1,000 lives, but the time to act is now. An effective strategic response will soon be out of reach as the prevalence of infection rises." Close quote.